Hi, my name is Kenya Daly, and this is my presentation on physical therapy.
Okay, so what is a physical therapist? A physical therapist is a licensed health professional who is responsible for helping people with limited mobility issues. So they're an important part of the recovery and rehabilitation process. They are also an alternative to surgery for people where surgery might not be necessary or who cannot afford the surgery.
So, a physical therapist evaluates and diagnoses patients who have limited mobility issues, and through those diagnoses, they create treatment plans that are individualized to each patient to help improve mobility and strengthen muscle. With those treatment plans, they also help to reduce pain and chance of injury within those areas, making the overall goal of these plans to help clients move more independently in their daily lives, and to help them move more comfortably, as well as regaining mobility in those areas.
So, the daily duties of a physical therapist include the evaluation of new patients and then
Creating new exercises and stretches for these clients to work on inside and outside of the facility, or if they're working in their home, then some exercises to do on their own. They also demonstrate these exercises and stretches to the patients while also aiding them in performing um, those same exercises. They also reevaluate patients who are established there with them, and checking on their progress, and then modifying the treatment plans if necessary. And then after, with every single patient, they are responsible for documenting all the patient care, including progress, reevaluations, or any interactions that they had with them.
physical therapists are needed in many places, including nursing homes where they work with a lot of the elderly, hospitals where they may be working with people recovering from a surgery or have dealt with an injury, therapeutic offices, which can also include people like audiologists or speech therapy, schools as well for many of those special needs schools, as well as people's homes where they can engage with clients who may not be able to make it to their facilities. But typically, you would see more of the occupational therapist working in homes. Physical therapists can interact with different people depending on where they work. They can work with several doctors or healthcare teams. For one patient, say a doctor refers them, or with a healthcare team, they can have many people that are helping this one patient, so they'll report together to as a team help with the rehabilitation or recovery. They also work with physical therapist assistants who typically help the physical therapists carry out certain tasks. Of course, they work with the patients and actually really closely with the family members too, since they do several of the exercises or stretches at home. They want the family members to also help them or understand the process so that they can be part of the rehabilitation process. Some physical therapists may be working for a larger company and have a physical therapy supervisor who is responsible for hiring physical therapists and making sure that all the work is getting done. All right, so in order to become a physical therapist, you must have your bachelor's in health sciences or biology or one of those related fields. You must also receive your doctorate from a CAAPTE accredited college or university, which stands for Commissions on Accreditation in Physical Therapy Education. You must also do some internship hours or clinical education, which is typically part of the doctorate program, but can depend on the school. And then, of course, to get licensed, you do have to take the National Physical Therapy exam in order to practice, which several states do require you to have that license. There are several ways that physical therapists can advance, including getting their PhD, which some universities offer, in order to further research in the physical therapy world. They can also become members of the American Physical Therapy Association, also known as APTA, which gives them access to newest research and further learning, also as a source of networking to make it easier for clients to find them. They can also specialize in different areas that requires at least 2,000 hours or 1 year of a residency in these areas,
which include geriatrics, so working with older people, pediatrics, which is working with children, and orthopedics, which focuses on therapy of the musculoskeletal system. So this is just my road to becoming a orthopedic physical therapist within the next 5 years. I'm currently finishing my last year here at USF and plan to receive my bachelor in health sciences by May of 2019. Then during the summer of 2019 is when I plan to do the internship or volunteer hours with a licensed physical therapist, as well as take the GRE, which is necessary to get into the doctorate program here at USF for physical therapy, which I plan to attend by August 2019. I plan to graduate by August of 2022 with my doctorate, and from there take the National Physical Therapy exam in order to receive my license. With orthopedic physical therapy, you do need to complete a residency of 2,000 hours or about a year, as I previously stated, which I plan to be completed by in January 2024 if all goes well. So here's a visual representation of my timeline, which starts this month of November in 2018, which I'm currently researching physical therapy programs. While I'm looking at USF, I'm considering other options. I also have more detailed steps and dates and times where I'll be taking exams or starting the next step. And looking for jobs, I do plan to use search engines. However, I do plan to take advantage of the physical therapists that I've met along my journey to help find a job that would fit well with me as long as with the residency, since sometimes the places that you do your residency, they are looking for people to hire. And last, these are the references that I used for my project.